Good morning, everyone, and thank you for joining us today. My name is Emily Hawk, and I'm the Special Sections Editor here at the Gazette. Before we get started, I'd like to thank ITC Midwest, our Iowa Ideas presenting sponsor. This session is being recorded and closed captioning access is available. Questions may also be submitted through the Q&A function on your screen at any time during the session. So let's get started. Iowa's hospitals are facing a perfect storm. About 70% of medical facilities report struggling to find qualified nurses, while at the same time, nursing schools are turning away prospective students because of capacity issues. This session will explore what some of our Iowa institutions and state officials are doing to address this industry challenge. With me today are Katie Lyman and Dr. Wendy Mim-Harold. Katie, would you like to go ahead and just start us off by sharing a little bit about yourself and the work that you do in this space?
Sure. Well, thank you so much, Emily. You've done such a great job in hosting and making sure that we have a wonderful presentation today. And I'm really excited to join Wendy again. Wendy and I have worked together for several years in a couple different capacities, and so I'm really excited to join Wendy again. As Emily indicated, I'm Dr. Katie Lyman. I'm the Dean of Health Occupations and Healthcare Simulation at Kirkwood Community College. And so we have several different departments at Kirkwood because we're a very large community college. And so we have a lot of different healthcare programs. So three different areas, three different departments. So we have a Department of Nursing, a Department of Allied Health, and then a Department of Health Occupations that I oversee. And within each of those are several different programs that we're excited to have students enter our programs and then enter the workforce. So super excited to be here. Thank you to Iowa Ideas. And again, thank you to my colleague, Dr. Wendy Mim-Harold.
Yeah, Wendy, if you'd like to go ahead and introduce yourself as well.
Yes, well, good morning. And Kitty's right. We've had a long-standing working relationship. And thank you, Emily, for doing the Iowa Ideas. And I'm proud to be here. I'm not working directly in healthcare anymore. I have worked for the community college system in Northeast Iowa for 24 years and helped to develop career pathways and partnering with healthcare providers throughout Northeast Iowa. I tell everybody from Nashua to Dubuque, a 5,000 square mile area. But over a little over a year and a half ago, I took on the president and CEO of Iowa Jobs for America's Graduates. So it's a different way that we're working. I'm working with 7th through 12th graders to help develop pathways for students to go into healthcare, manufacturing, and other sectors. So I'm going to talk about that perspective. But I also did my PhD research study in regards to the skilled workforce in the state of Iowa. So I'm proud to be here, excited to help share some insight. A fun fact, I also worked for the regional manager for Iowa Workforce Development for 10 years with my 24-year history of working at the Northeast Iowa Community College. So I've been around for a while, and I'm excited to help give some insight on the healthcare needs throughout the state of Iowa.
Awesome. Well, thank you, Wendy, and thank you, Katie. So I will go ahead and just dive in here. So as I stated in the introduction to our session, about 70% of medical facilities report struggling to find qualified nurses. Why is this? What factors are contributing to this shortage specifically?
I'll start with a little bit on this. I did some additional research again, looking at some of the newer data. And one of the things I want to say is the healthcare shortage is not a new prediction, right? We were starting to address this issue in the early 2000s, and multiple state governors and officials have been continuing to work on this issue. In the healthcare arena, there is so many different occupations. It's when people think of healthcare arena, they think just of nurses and doctors, but you really have to look at healthcare holistically. And the need has been continuing to grow because there's competition, there's retirements, the baby boomers going out. We have an aging population. We also have a population that is wanting to live in their housing, in their current homes. So that creates more home health occupations as well. And also we have all the multiple services for individuals who experience disabilities. So the range of healthcare is strong. Also in regards to the need for, I call it brain health. Brain Health Now, Debbie Butler's initiative is really looking at the stigma of mental health and really using your language, using brain health. So the need for counselors and psychiatrists is also growing through the need and coming out of COVID. But I will just kind of throw what are some of those different areas of need. And I really like how the Department of Education, when they worked on career pathways, they characterized it as the caregivers. That's your RNs, your CNAs, certified nurses aid, your doctors. You have to remember you need emergency medical tech people in the community to respond to the emergencies, the pharmacists, the dental. So that's, you're looking at that, the caregivers, and you're looking at that supporters, those psychiatrists, health educators, the direct support professionals and counselors that are needed. Then you have to look at when you're at a hospital, one of the greatest needs is if you broke a bone, you need a radiologist. So you need the radiologist, you need the radiologist techs, the phlebotomists, the lab workers, the chemical lab techs, excuse me, can't talk this morning. And then also looking at, you have to have the background, the infrastructure. So the computer information systems, the managers, the marketing, the customer service, the sales, medical equipment, transcriptionist. I mean, all of those other supporting areas. And then going into just the operations of maintenance and the fitness that goes in, medical equipment, accounting, human resources. So holistically, if you look at all of the needs in the healthcare, it's dramatic. It's a large population of occupations. And so making to replace those positions, it's really important that the awareness and exposure of those occupations is given to all ages and students. And that's some initiatives that we'll talk about in a little bit.
Thanks, Wendy. Katie, do you have anything to add to that?
So I'll just highlight a little bit. One thing that Wendy talked about early on in her comment was that we have an aging population, and so we have more people who are demanding greater health care. And so I think that's one thing that we know that we have this aging population. We know we have baby boomers. We know we have more individuals who are in need of nurses, as your question was related to this, kind of the nursing shortage. And so as Wendy indicated, is that it's not a new problem, is that we know we've needed nurses for a long time. We can all talk about, of course, the international pandemic that occurred in 2019, 2020, which caused a lot of people to leave the healthcare arena, as well as fewer people who want to pursue healthcare with those greater expectations and demands on an individual when they're in the workplace. That was a really tough time in our history, and I think we're still analyzing that historical trend in looking at why and how we get more individuals into that space. And so, like I said, it's definitely not a new phenomenon that we've had, that we have a need for not just nurses, as Wendy indicated, but a plethora of individuals who are required to run a hospital or a clinic. And now with there have been some initiatives to get more individuals excited and interested in the healthcare industry, but I still think that there is some work to do. And I think we're going to talk specifically. I'm in higher education, and my colleague is in 7 through 12, and so I think we're going to be able to talk about some of those specific initiatives here in a little bit.
Absolutely. Thank you, Katie. So I know that you both touched on the aging population as well as the pandemic that we had in 2019 and 2020. Could you maybe talk to me a little bit about wages as well? Do you see that being an issue that's contributing to this too? Are our nurses and healthcare providers, are they being paid adequately? What are you hearing from the recruitment side of things?
I'll let you start on that one, Katie, and
Okay.
chime in.
Okay. Um, so, I would say that there are a couple factors associated with that.
Mhm.
It depends. It's very dependent on the level of provider that you are. And so, if we're talking about a certified nursing assistant, you're looking at, 16, $17 an hour starting wage, which obviously as you have a higher credential that you are likely to get paid more. So this was really examined during, and after the pandemic, as to what we're asking our healthcare providers, specifically our nurses, to do on a daily basis. And so, knowing the work that they're doing, we're never paying our nurses enough to care for individuals. When they need another individual so badly in their life. So I think it is a factor in as to why people it's hard to get to that higher level of care if you don't start at a base with like a
Mhm.
CNA or an EMT or a radiology technician, right? Is that we have some of these lower level positions that most people start in and to scaffold and to build into a higher level. And so it can be really difficult work that you're just not getting paid enough for. So I think that's one of the things that we do need to examine is how much are we paying these individuals who don't have a higher credential, but are doing really important work that can often go really unnoticed. And so that's where I think investing in some of those lower level positions in order to build them into LPNs and RNs and nurse practitioners and really making sure that there's that pathway and that scaffold to build into higher paying careers.
And I would
Absolutely.
just go
Go
ahead,
ahead.
Em. I was just going to absolutely say, I think it's really bottom line, focusing on career pathways. If you look historical entry level positions and as a certified nurse's aide, for example, in a long-term healthcare or in a hospital setting, that wage has increased significantly since 2000. And that's based on demand and need, right? That helps increase that wage. But
Mhm.
I do think what's really been great with all of the hospitals and healthcare providers and the education system is what Katie just mentioned. It's really about developing those career pathways and bringing students in and having them earn and learn. And so that they're working and learning and seeing that they can continue on that pathway to get those higher dollar occupations has been successful through the years and will continue to be successful. And more of all of the hospitals and clinics are getting engaged across the state and across the nation. And I really want to emphasize this isn't just an Iowa problem. This is a nation problem.
Mhm.
And I think one of the things that's so important when you talk about wages, it's that competitive wage. So, there's multiple occupations where you can get paid about the same as a CNA. So the certified nurse's aide occupation has definitely lifted up that wage and has looked at that competition outside for recruitment. So I think that there's been significant movement upward on that area.
Mhm.
Emily, can I just add one more quick thing related to
Yeah.
wages?
Yeah.
And I don't know if there are any hospital administrators with us today, but I know that everybody would love to be paid more for the work that they're doing. I think one of the things that I've really been intrigued by is the creativity that employers have implemented in order to reduce some pain points for their healthcare workers that they may not be able to give everyone an across the board 5% raise, even though they absolutely deserve it. But things like offering oil changes right at the hospital, right? Or dry cleaning services and so, daycare services. So some of those types of things that can really be an added benefit and reduce those pain points again, it's really hard to give an across the board 5% raise when so many of our hospitals are not operating with a huge with a huge revenue
Mhm.
that they can just be handing out money hand over fist. And so I've really appreciated how our healthcare industry has really been creative in trying to assist their workers with their quality of life, which is really one of the things that um, that will assist an individual in making sure that they are able to care when they are working, that they are able to provide that high quality care, as opposed to thinking about, is my child doing okay at daycare? How am I going to get this oil change when I know that my car is about to implode on me? Those types of things. So
Mhm.
kudos to our healthcare industry experts for trying to figure out and how to reduce those pain points and really increase that quality of living for their employees.
Emily, and I just would like to chime in a little bit more because I just
Yeah.
am so impressed by the healthcare sector of what they've all done to help lift up students and to help lift up their employees. They've also have amazing scholarship opportunities. They have looked at doing forgivable loans. Their sign-on bonuses for coming to work has just been a really great initiative to help holistically, because when you're in a nursing program, it is intense. It is very, very, very hard work. And if you're in a nursing program or an accelerated program, it's your life. And so having those other services that can help take the burden off the tuition to go
Mhm.
to school, the last dollar scholarship that the state of Iowa has implemented to go into the healthcare field is just a great opportunity so that they can stay focused. But there's the cost of daycare and childcare while they're going to school. And so that holistic wraparound services, hospitals and clinics have got engaged in finding creative ways to help with that as well when they're doing the earn and learn models. So it's been really neat to see the creativity that has been implemented across the state to help individuals get into the healthcare career field.
Absolutely. Excuse me. So as we're on the subject of nursing schools and nursing education, there have also been reports that there is not enough space, and they're actually turning away some prospective students who are interested in becoming nurses or just in the medical field in general. Um, and they attribute that to a decline in qualified instructors,
Mhm.
which exacerbates that problem. Katie, is this something that you are experiencing or that you've seen at Kirkwood? Could you maybe talk a little bit about that?
Yeah, we have experienced this, is that we are looking for, and I'll put a plug out for anybody in the audience, anybody who's interested in being an adjunct instructor. I think it's one of the things that makes Kirkwood really, and any community college, as well as our four-year institutions, what makes it great are our instructors who are subject matter experts. And so adjunct instructors can really bring a totally different dynamic to the classroom because maybe they've had 20 years as an OB/GYN nurse, right? And those are the types of individuals that they have that experience. They understand the nuances and the minutia of the position and could really add so much value into the classroom for a specific OB/GYN course. And
Mhm.
so, being an adjunct instructor at any of the higher ed institutions, we are always looking for instructors. And I know during Iowa Ideas, there was a session on the teaching shortage, and we're experiencing the same concept, the same idea. And so, yeah, we're always searching. We always have ads to add instructors for most of our programs, and so we need more qualified instructors. I think that's one element to why why students aren't able to get into the professional phase. I don't think it's the only reason, but I do think that we need to incentivize teaching as well. Nursing is hard work, as is teaching. Is that it's not just the 90 minutes in the classroom, it's also the pre and the post, right? It's getting ready for that class. and it's helping our students navigate. As my colleague just indicated, nursing school is really, really hard. Any of our professional programs, respiratory therapy, occupational therapy assistant, athletic training, whatever it might be. And so how are we providing that support? And so it can be tough on instructors because that's usually where students turn to, because that's their first point of contact. And so it is about it's not just the teaching and I have information and you will learn the information that I have in my brain. It's so much more than that. College has become um, more aware of the holistic student. And so again, I think, yes, we are always looking for instructors. I think it's one element as to why we can't admit more students, but it's not necessarily the only reason. But I will put a plug out there. Anybody who wants to be an adjunct instructor, we have space for you, and we'd love to hire you at Kirkwood.
Wendy, do you have anything to add to that from the IJAG perspective or grades 7 through 12?
What from the IJAG perspective, we're helping to get students exposed to those careers. So I would say it's along with having instructors, it's making sure that we can get students into career pathways as early as possible. So we have a lot of events where we do hands-on interactive education on the healthcare fields with our Unity Point, for example, or Mercy and other places across the state. And so do the community colleges and the universities. It's just so important to get students exposed, but also exposed to the education opportunity. And even us, as we hire instructors too to be in the classroom 5 days a week with our students to help expose them to academic and career planning. That's what IJAG does, and making sure that we holistically get them engaged in multiple careers. And I will tell you, we hire professionals that have been in the workforce, and it's been a challenge in that area as well, because it's just the shortage of people. And so it's just making sure that you look at all avenues of how you can recruit those individuals to go into teaching. I do want to say though, too, when I worked at the community college, I think one of the things is really important is clinical sites, having multiple clinical sites where students can go to that hands-on experience. We have multiple health simulation opportunities, but there's nothing more important than having that hands-on clinical. And I know that that's been some challenges. And so there's been some unique ways that clinics and hospitals are addressing it through apprenticeship model. So I think that that's another way. You still need additional teachers to be able to do all that. It's that time and dedication to be able to work with students coming into the program.
Absolutely. And Katie, so I'm going to put this back on you again. So, obviously a decline in qualified instructors is exacerbating this problem of students being turned away. But you mentioned that there are other factors that are contributing to this. Can you talk about those as well?
Sure. I mean, I will talk a little bit about wraparound services, and that we're trying to meet the needs of our students, absolutely, because again, we recognize that very few students can just kind of like stop their life and just go to school, right? Is that there are childcare services, and they need to work and some of those things. And so when somebody's trying to make a decision as to whether or not they're going to pursue any type of a degree, whether it's entry level, whether it's advanced, it's really something that they have to stop and think about, all of the factors of will it allow them to be successful. And so I think about in health occupations, we talk about two things when we're implementing various initiatives: is it adding value? Is it decreasing barriers? And I think those two pieces are really integral into making sure that we have high quality students that are ready for the workforce. And so I would say decreasing barriers is probably where we spend most of our time to make sure that students can pathway through, right? And so, Kirkwood has done such a great job at most colleges and universities at this point. Food pantries additional counselors, activities in order to formulate a community. I have learned the value of community and that it's really hard to do life on your own. And so who are those people that can support? And so that's really important to colleges and universities that there is that focus. I've done a lot of work in economics and looking at how much of our expenses are going towards instructional pieces as opposed to student services. And it doesn't I apologize for that word because they aren't in opposition to each other. They need to be going side by side for a student in order for them to be successful. And so colleges and universities, we need to make sure that we have prepared students. It's not just about, hey, you have a pulse and you have this credential. There's more to it than that. And our employers and our industry partners are expecting that, is that, are these individuals who understand the scope of practice, who understand the demands of the job, who understand you can't violate HIPAA, right? So all, ethical and moral human beings. And so all of that. And so we do have to have sometimes some prerequisite courses in order to get into formal stages of a program. And those are important. We have to have nurses who can do some math, right? And we have to have occupational therapy assistants who know the anatomy and physiology of the human body in order to be able to provide high quality care. And so, the prerequisites are important. I know it can sometimes look like a barrier, but what I want to say to our audience is that I have been in some rather robust discussions where we are being very intentional about what makes sense and what is required, as opposed, needs versus wants. And all of you are doing that in the audience as far as when you are looking to hire, is what are our needs and what are our wants, and how do we make sure that both are being met. So yes, I think there's the lack of instructors, and that's one of the things, but it's a tough process. It's a lot of factors in order to consider, and some of those factors are changing. Is that the food pantry wasn't heard of until the international pandemic, and now we talk about food scarcity. It's not that it didn't exist before the pandemic. It's just that this is what our consumers are demanding of us at a higher educational institution. So some of those needs change and they fluctuate, and we need to be responsive to those needs of our students.
I'd like to just chime in a little bit. From the IJEC perspective, we are a supplemental education that we're invited into the middle schools and high schools to provide services to students who have a want, need, and benefit that from having further academic support and career awareness. So our whole goal is to get students either into post-secondary education or into an employment earn and learn pathway. And holistically, what my colleague just spoke about is what we're also supporting. We're making sure that the students, and I call it, we make sure that they have exposure to healthcare. We make sure that they have some relevancy experiences so that they are touring or having hands-on, starting in a job in the healthcare at the very beginning level to stay into that field. But also we make sure that they're taking some of those courses that Katie alluded to, those prerequisites, while they're still in high school, so that they can immediately get right into their LPN or their RN, so that they're moving down that. But we're also holistically looking at making sure that we're addressing their transportation issues. Also, where we really work very hard with the students is to make sure that we address the human skills, which is communication, customer service, that empathy, that confidentiality, really learning how to solve problems, leadership, all of those skills, which are absolutely critical, as Katie alluded to be in that healthcare arena. So I think that that's a really important fact that I'd like to bring, is that the education system knows that they need to address this and is working towards that, and really looking at ways that we can grow future leaders, but also make sure that they're connected to those amazing opportunities in the healthcare sector and addressing holistically the needs that they have so that they can get to that next level to get to education. So my point there is that, as Katie said, it's something that's so important that continues once they go into school, because there is that continued need, because we're empowering and lifting students up to be their best selves. And so it takes all of us. And the food insecurity has definitely been something that we see. We have food in every one of our classrooms just to make sure, and access to food pantries. So it's really looking at the student. The adults are the same way. Once they graduate, those needs don't go away.
Mhm. Absolutely. So let's think about, now that we've laid the groundwork for this, how is the nursing shortage, or even the workforce shortage that we're having in healthcare? What are the consequences of that? You know, how is it affecting patients in our communities?
You want to start with that, Katie?
Sure. The trouble with moderator and panel is you never really quite know. I think we've talked about, there's lots of news reports about, it probably goes without saying is that a lack of healthcare providers, there is going to be a reduction in healthcare services. You've probably noticed this with longer waits, right? Is that it can be, if yes, there's a provider shortage, but if there is also nursing shortage, and when it goes down the line, is that then they can't do their great work, their good work. And so therefore, then it does trickle downstream to the consumer. And so that's a piece of it, is that if there's a nursing shortage, they're unable to support the providers. And so therefore the providers don't have as many slots to be able to see provider or to see patients. And so yeah, like I said, that we've talked a little bit about this. It's probably been embellished in the media a little bit, but it goes without saying that there is that downstream effect of, if we don't have the healthcare workers, and all of the healthcare workers, even those who don't have direct patient care. So
Mhm.
as Wendy indicated earlier, it's medical transcriptionists, it's patient care technicians, it's emergency room technicians, it's all of the people that make an organization run, that provide that care to a patient. So it's not just about that direct patient care. So it's something that we need to be mindful of. It's something we need to continue to partner with our industry partners, understand their greatest needs, so that way we can try our best in higher education, as well as even before higher education, as Wendy is experiencing, in order to try to remove those barriers for individuals so that they are able to pursue seamlessly. So the things that they're doing at the K-12 level, with high school academies and some of those things, that they already have their CNA or something like that before they get into college, so that way they can immediately pursue. So from a patient perspective, it's something we need to really consider and recognize. We can look at patient care surveys to see, but I think it's deeper than that. It's even just trying to get that appointment. And when it's 3-4 months out, that becomes problematic for those patients, especially when it relates to mental health, and some of those pieces that people don't have 3 or 4 months to wait for their diabetes care.
And I will say, as a consumer of healthcare, and having 2 sons that are type 1 diabetic, we've been very fortunate that there are specialty doctors that are throughout our state and the tri-state area. But I will tell you, you need to have your appointments well in advance. So it's that where that emergency care is so critical, and I'm looking at from the paramedic side, the EMT in the community. So I live in Des Moines during the week, but my home is in Northeast Iowa. And my husband has been an emergency medical first responder for 30 plus years. And their squad was getting down very low, just even getting folks who want to volunteer and being able to get those paid professionals to be in those positions. And the community did a lot of outreach and were able to increase in getting um, young professionals that want to go and assist and help. So, and it was just exposure. So there's a lot of communities that are just being so creative because they know what their need is. And it's getting individuals engaged, getting other people to say, hey, I think you would be great at being able to help in this area. Have you thought about the healthcare career? Because everybody knows you want to be able to have that emergency help is immediate, and no one really likes waiting for appointments. But the reality is, talking with the Iowa Hospital Association and looking at their website, their greatest openings, and also with the state of Iowa's data for Iowa workforce, is in registered nurses, lab technicians, radiology technicians, ultrasounds, physicians, and respiratory care. So if you look at that, that's the ability to get in and get your blood work done and taking longer to
Mhm.
get that. Radiology, if you break a bone, and that wait to get into, yes, has technology changed and they can bring in the radiologist right into your room if you get into the emergency care, but you got to have people to be able to do that and be trained in that area. So that's really important. The ultrasound ability, and then physicians to see you in from the hospital to the ER to those specialty cares. So it's so important. And as my colleague alluded to, the whole brain health crisis from COVID is, and having that psychiatric care and access to counseling is extremely important. And in rural Iowa or in urban Iowa, it's difficult to get into some of those appointments. And so how do we continue to address it? It's telling the story holistic of the need. And and none of us really like to wait. And so I'm coming from a patient perspective, not from an expert's perspective on that.
Thank you both for that. So I know that both of you have also kind of touched on this as well in your other responses, but what are Iowa institutions and state officials doing to address this industry challenge, not only for nursing, but some of the other medical um, professions that you've mentioned are experiencing shortages? How are we addressing this issue?
I'll start and then I'll let my colleague chime in on this one. I would tell you that from the state perspective and the history from the early 2000s to now, there's been a consistent effort to look at ways that funding for students to go into these occupations. The Future Ready Iowa initiative through the governor and the state of Iowa for the last dollar scholarship to pay for students to go into healthcare has been an amazing opportunity. I'm going to do a huge shout out to all the community colleges and universities and healthcare programs. They've done an excellent job of instituting career pathways so students can take college level courses while they're still in high school to get that introduction to health occupations in place. Medical terminology, they're certified nurses aid. So there's other courses that they can take while they're still in high school to really be ready to go into that healthcare arena. There is the HOSA group, which is state and national, which is for really getting students prepared into and the awareness and the competitions to get them interested in excelling into the career occupations. There is the work-based learning initiative that the state of Iowa has put in place with Senate File 2411 to assure that all students, by the time they graduate, that they have an authentic work-based experience, which is really what IJAG has been doing for years, is making sure that students have awareness on the educations and on occupations, that relationship, making sure that they have that exposure. So they're getting in and seeing all the opportunities. We've had students that have been able to watch in on surgeries. We've had students who have been going through immerse 3-week boot camps about all the different healthcare occupations. We've had students who have been able to be a part of the touching and learning the skeletal systems, getting their CPR, their CNA getting started and funded by hospitals and clinics and partnerships throughout the state of Iowa. So those initiatives are just absolutely critical. Then from IJAG, we have that immersed job experience, earning and learning. So because a lot of our students work while they're still in high school. And if you can get them in a high school into a career pathway in healthcare, hopefully we can help them continue to excel. And finding out they may not feel like that nurse is their passion, but maybe they want to be in the back end of a hospital in the healthcare or the rad tech or lab. So we need to make sure that they have the exposure to see all those great opportunities. So that is what we do through IJAG and the initiative through the governor for Senate File 2411 to assure that all students have that work-based learning experience by the time they graduate. I think that's really going to continue to assist. Also, the initiatives from the state of Iowa with the Earn and Learn and having apprenticeship programs that have been put in place and partnering with the hospitals and clinics is just critical. And seeing how they've continued to expand, I think has been a phenomenal opportunity for any size of an organization that they can be engaged in those opportunities. So I would tell you those are just a few. There's plethora of information on the Department of Education about healthcare careers that you can do. The Iowa Hospital Association has information about healthcare fields. There's a lot of interactive career fairs that are happening across the state of Iowa. I know that the Des Moines Partnership has been doing a series on work-based learning to help educate individuals who have not been engaged in it and how they can become engaged in it. It's been something that all economic development chambers, businesses, community colleges, organizations are all partnering in any community. So I think there's a lot of initiatives that are happening across the state, and it's just taking that step to get engaged and tiptoeing in it if you're not. So I'll stop and I'll throw that over to Katie.
So two things I would want to focus on from a higher education administrator perspective. Number one is to look at the format in which we are delivering education. So one of the things we did a couple of years ago is looking at hybrid. And so we have some hybrid EMT courses or EMS because our hybrid EMT program was such a huge success that we've actually we've incorporated into most of our EMS programs, so EMR, AEMT. And it was actually highlighted by the Iowa legislature last year because students need access to education, just like they need access to healthcare, and it needs to be easily accessed. And so that's not easy to do if you live in, say, Washington County and need to drive to Cedar Rapids, Iowa, for courses, right? And so at Kirkwood, we have a lot of different regional centers, so to try to reduce the travel time, but that's where, if you look nationwide and you look at higher education, that's what higher education institutions are trying to do, right? You look at some of these like online programs and things like that it's easy. You can do your homework at 2 a.m. if the baby's awake, right? And so those are the types of things that higher education, we need to meet students where they're at. And maybe that's geographically, maybe that's time. And that's what hybrid has allowed students to do, is to be able to do work when it works for them, not when it's convenient for us, right? So that's one of the things is looking at the format. The second piece of it would be the actual pedagogy. So I'm a huge proponent of competency-based education because what we need is for students to understand the entire curriculum at least an entry level base knowledge. Okay, is that you can't have somebody who really understands the respiratory system but doesn't know anything about the cardiovascular system, but their average is a C. Right. And so, but when doing competency-based education, we allow students, something that K-12 education has done is to reassess, is that it's okay if you don't understand the cardiology system the first time. Can we get them to understand the cardiology system by the second attempt? But then they've learned it. So it's not a matter of, can you do it first. It's can you eventually learn it within that course? And so, like I said, the two things are access, which means format, being intentional with the format of delivery, and the second piece of it is that actual pedagogy and making sure that that our students are workforce ready and that they truly understand the material.
And so, what resources are currently available to address this challenge? I know you talked specifically about a few things, but is there anything else you'd like to add to that?
I think between the two of us, we've talked about like there's financial, there's wraparound services, and there's just a plethora of items in order to try to help reduce the I'm not just gonna say nursing shortage, but healthcare
Yes.
worker shortage.
I think the biggest thing is continuing to COVID and the images that people saw in healthcare probably scared folks, right? And it's really about making sure to understand the whole healthcare arena of all the amazing opportunities. If you really think about it, in Iowa, if you're looking for a job that is always going to be there, it's going to be in healthcare because there's always going to be that need. And so knowing that if you don't want to be a nurse, which is a phenomenal occupation, there are so many other occupations within that healthcare. And it's just making sure that we continue to expose, we continue to educate. We really have the initiatives that have been happening across the state and continuing to look at having all of the different resources for wraparound is just really important because if they're immersed in their education, and if I was an adult student going back and still trying to raise my family, we have additional needs that have to be taken care of. So anything that can help holistically is really important. And that's been great how the healthcare arena has really looked at that holistically, the student, because it's not just getting paid to get into the program, it's also helping them to be successful while they're in the program. And I think the initiatives of work-based learning that the state has really challenged everybody to do across the state to assure that we have that exposure for students, that's going to continue to make a difference because they're going to be able to get in hands-on working experience. And all the programs that the community college system and the universities have in place so students can access education at the stage when they're ready to access it. And they, as Katie alluded to, it's nights, it's weekends, it's accelerated programs. So there's so many different options that are available. And it's just making sure you connect with someone. The state of Iowa has career and educators that are in the schools. You have IJAG that's in the schools. You have high schools that are doing work-based learning initiatives. There's counselors in the schools. There's multiple resources of folks that you can talk to and partner with to make sure that we're having those pathways to get into the healthcare arena. And that's what I would make sure. If you're not engaged, you need to get engaged.
And so I have one more question to close out our session for both of you. So you both work in career readiness in some capacity and are tasked with helping young people find and establish themselves in the workforce. What advice would you give to a young person who's interested in pursuing a career in the medical field?
Well, I will tell you the advice that I give all the time is make sure you get some exposure to know what it is. We use this example, but it's a true example. Students state that they want to be a nurse, and then they go in and they see the sight of blood and seeing what they have to do, and it's not what they want. So it's just really making sure that you have that exposure. Take advantage of those immersed job shadows. Take advantage of the boot camps that are out there in the healthcare field. Take advantage of getting into the opportunities when they allow you to go into the environment and see what it's really like. And I tell everybody, start on a career pathway. If you're interested in health, I think working as a certified nurse's aide helps you get that empathy, that patient care. It's a great starting point, but you can start in dietary in a hospital. You can start in maintenance in the hospital. There's multiple entryways of where you can get in to get started. So it's just making sure to ask the question, what is available, and be immersed in the opportunities that are available to you.
I think with that, it's once the decision has been made, I'll talk from more of a higher ed perspective as opposed to K-12, is once you've made that decision, it's really to be honest with yourself, and recognizing that, almost doing like a SWOT analysis is what are you going to need in order to be successful? Because when everything's going great, it can be easy to get through college. But if you're a parent and all of a sudden your child is sick, well, now what? What's the plan B? And I don't mean plan B as in you need to totally scrap your goal of becoming a nurse or respiratory therapist or occupational therapy assistant or athletic trainer. It doesn't mean go to the next career. It's what do you have in place for those support mechanisms? What do you have in place even for if you're a pet owner and your dog has gotten sick all over the carpet, but you have a midterm due? Like what are you going to do? And that's what I see so often is that students get derailed from their goal because they haven't planned ahead as to what does that look like? What community support do they have for even, like I said, what would seem as like a trivial thing of your dog getting sick all over your carpet? You can tell that probably just happened to me. Is that what do you have as a resource in order to get yourself back and ready and like, okay, and now I have to do a midterm and I'm going to stay up until midnight. And now how do I turn that around for the next day? Right? We're all trying to do our best at adulting, and adulting can be really hard. And so I think that's one of the big pieces is that you have to go in with some plans B through Z in order to not get derailed from your ultimate goal. And so we do a great job of this at Kirkwood. They do a great job with it at all the institutions trying to provide the support, but at 10 o'clock at night, no one is helping me clean the carpet. And so how have I planned in advance to make sure that I can be successful? So I would say that's the biggest thing is what are the services that you think you're actually going to need? Your kid is going to get sick. A parent is going to need to go to an appointment that you need to take them to. And so what does it look like for you individually? And knowing that you have those systems in place and that community in place to help you achieve your goal.
And Wendy, is there anything else you want to add there?
I just wanted to say, spot on. It's really that whole resiliency and having a plan. And, that's for every career. But in the healthcare, the studying part it is a program that is not easy, and you're going to have a plan. I love how she said that A through Z, but it's looking at that transportation, the childcare, the car can break down, or if the bus is late, whatever that may be. It's really having that plan in place, and really it's that growth mindset and resiliency that we teach every day in IJAG. It's about, you know what? Life is not easy, and you're going to get a curveball thrown at you, and you get curveballs thrown at you even while you're in high school, sometimes on a daily basis. So how do you overcome that? Because it can be easy to give up, but it's worth the work to get there, and it's preparation and planning. And that's where it goes down to. I mean, when I know that I have to be up at 4 o'clock, I have 2 alarms, because what if the other one doesn't go out? It's just always making sure that you are prepared and planning through life. And so it's just critical. And that's something that we do teach in IJAG. And I just think that I just wanted to hone in on that fact that that's so true.
Absolutely. And I'm so sorry, but I lied to you both. We do have an audience question, so we do have one more question before I let you go. How can Iowans help reduce the worker shortage in the medical field specifically?
Well, I'll start. At Iowans, how can we help produce the workforce? I think it's about one of the things I tell everybody, we can get students into the healthcare arena. But if the person they meet with talks about that they're burnt out, the job it's tough, were not getting paid enough, you've lost them, right? So it's all about bringing your best self when you have students into your job shadows, your immersed opportunities that you're providing. I think it's very important. And I tell everybody, when you talk positively, you tell 10 people positivity about all the amazing careers, that's 10 other people, that multiply factor, you can get to 1,000 people. I think it's just so important of the images, how we talk about the healthcare field, how we talk about it holistically of all the needs, from the dentist to psychiatry to RNs to, as Katie even mentioned, it's veterinarian services because through COVID, I think you can see there's been an explosion of pets. So someone to be able to take care of their pets. So it's all of those holistic occupations and services, making sure that we educate on what is available and making sure that we're talking positively and changing the negative connotation about being in the healthcare from some of the views that they've seen through COVID. It's very different than that. And so what's depicted on TV and what's reality is always not the same. So making sure that we all become positive about that healthcare need.
Mm-hmm.
And I would just say, just quickly, how do Iowans help with this? And so I'm kind of wondering about the question. Is it I'm going to take it as just like a regular citizen. Is how do
Yeah.
you help? How do you And I think it's a couple of things. How can you give back? Maybe it is that, you know what? Maybe you have the financial capability to go knock on Casey Green's door at Unity Point and say, I would like to I would like to support a sign-on bonus for athletic trainers, for paramedics, for whatever. If you have the financial resources to be able to give back in that way, great. If you don't have the financial resources, or if you don't, what can you give? And maybe that is, hey, I know that my neighbor is going to nursing school. Maybe I can say, hey, you know what? I could pick up your child. Right. I drive past that school, and would it help you? Would that alleviate just some time that you can either study or you can do your laundry, right? Just giving back, it does take a village for us all to get through. And so I think it's, again, when we are preaching to our students of like, have plans and prepare, because it's not all going to go according to plan, is that who do you have? And so if you know that your neighbor or a member of your church, or just somebody is going through, is how can you help them? What can you offer them? What can you give of yourself that wouldn't take much effort? That you could help somebody continue on their path, not get derailed, and therefore end up giving back to healthcare. And so it's just I would challenge it back of what can you give? Is it financial? Is it time? Is it gas? What is it that will help our students and our potential employees really continue on that path and achieve that whatever credential it is that they're trying to achieve?
You both were absolutely wonderful. So I just want to have a big thank you to our panelists and for our attendees for spending your morning with us today. If you do have further questions about this topic, you can start a conversation in the Whova app or reach out to our panelists directly there. I'd also encourage you to tune into one of our 1045 sessions, The Value of Local News or Curious Iowa. Thank you so much again, Katie and Wendy. You are absolutely wonderful. I'm so glad that you could join us today. And I hope everyone has an awesome Friday.
Thanks, Emily. Thank you,
Thank you
Wendy.
so
Thank you,
much.
Emily.
See you later.
Bye.